Now let's focus on 4 key pillars. The first one, patient empowerment. From passive recipient to informed user expert. Let me start with a simple image. Imagine boarding a flight in the 1970s. You arrive at the airport, you don't know the flight status, you don't know the delay reason, you don't know the weather. You sat there trusting the airlines and waiting for the announcements. You sit there with hope. Now, fast forward to today. What is happening? Even before you leave home, you've already checked in online. You have selected your seat, you're tracking the aircraft's location in real time. You know if it's delayed even before the airline announces it. I am Dr. Arokia Antonysamy, consultant psychiatrist, CEO and co-founder of a digital mental health platform. So, what's changed today? It's information symmetry. In healthcare, especially mental health care, we are still operating in the 1970s model. Our patients are waiting, they are guessing, they are hoping, they feel powerless. In psychiatry, that powerlessness is amplified. When someone is struggling with anxiety, trauma, depression, ADHD, they are not just symptomatic, they are living in that uncertainty, the long waits. That uncertainty increases their distress. And it is well documented in cognitive psychology research that ambiguity or uncertainty triggers heightened stress responses in the brain, particularly activation in the amygdala and anterior cingulate cortex. These are 2 areas in the brain that deals with your emotions. Not knowing what's happening can be more disturbing than knowing something is wrong. Yet, we ask our patients to wait for several weeks to several months for clarity. This can be harmful. Patient empowerment is not about giving people leaflets and documents about their care. It's about structured, clinically validated empowerment. There is strong evidence across healthcare that informed patients experience better outcomes. The concept of patient activation, studied extensively by Judith Hibbard and colleagues, demonstrates that patients who understand their condition feel more confident in managing their condition. This leads to reduced hospital admissions and better medication compliance. In chronic disease management like diabetes, hypertension, education plus digital self-monitoring has improved patient outcomes. Why should mental health be different? My platform shifts the patient from what I call victim helpless mode to reasonably informed user expert mode. Not self-diagnosing recklessly, not replacing clinicians, but arriving prepared. Imagine a consultation where the patient says, I have gone through this assessment, I understand my risk factors, I've reflected on my trauma history, and I've documented some of my experiences. Do you think this is threatening to clinicians? No, this is transformative. In aviation, we have moved from blind boarding to informed travel. In banking, customers no longer wait for quarterly statements. They track transactions in real time. In education, students across access the online modules even before entering classrooms. Why is mental health care still operating in a passive mode? I think patient empowerment is crucial. It reduces stigma, and when you understand your symptoms, the shame fades in the background. And here is the psychological shift. Victims, they keep waiting. Participants, they begin to engage. But user experts, they collaborate. We need to see that shift from victim to participant to user expert. That is when they are truly empowered. It is about dignity, and dignity reduces suffering. If we want people not only to survive, but to be successful, we must give them knowledge structured through clinical rigor. No social media trends, not influencer psychology, pure structured clarity. Now, let's move on to the second pillar, which is about evolution of mental health care delivery.